So what inspired me to become an oncologist was my relationship with another colleague in grad school. He was another grad student in the same lab, and he was actually diagnosed with stage 4 Ewing Sarcoma. I really didn't understand, the journey that a patient experienced living with cancer until I experienced this firsthand with this colleague, and just kind of understanding what his goals were and how he tried to persevere to obtain those goals as he was going through treatment really was an inspiration to me and still inspires me to this day. So I am a upper GI oncologist. So what that entails is I treat cancers of the upper GI tract consisting of the esophagus, which is the food pipe, and the stomach. It's where food kind of empties after you swallow. These are cancers that are actually increasing, and they are affecting increasingly younger populations. Specifically, stomach cancer used to be a cancer that affected many people in the world because there was a bacteria called H. pylori that really was prevalent. More recently, we have good antibiotics, good surveillance for H. pylori, so the incidence of stomach cancer actually fell quite dramatically. But now there's increases in different types of stomach cancers and these esophageal cancers. So I see a lot of different patients from a lot of different backgrounds. And I think understanding cancer from a patient's perspective and having that empathy is really important. My journey to understand my patients is to really understand their goals and see how I can work with them so that they can obtain their goals. I believe in what I call shared decision-making. So it's basically the opposite of paternalism, how basically physicians used to practice. Shared decision-making is I will tell them my recommendations, and not just my recommendations, but the reasons I am recommending them. But I also give them other options, and then the pros and cons of those options. And then oftentimes, I'll tell the patient, think about those. You don't have to make a decision now. Call me in a day or two, or we'll come back here next week, and then we'll have another discussion about your decision and why you made that decision. It's an active process of learning about them and not rushing into a decision, because I would rather them be very comfortable with this journey that we're about to set off without any questions in the back of their minds. As a physician scientist, I think it's not just important, but it is central to our job to bring the lab back into the clinic. And I think that is my goal, and it's something that I think about every time I'm at clinic, every time that I'm seeing a patient. How can my research, far removed as almost you can be from these patients, how can I take that and how can I use that to improve treatments, diagnostics for these patients? And I think that is what I try to bring to Siteman, and that's what I tried to bring when I came back here to WashU. I think what's most rewarding for me working with patients is establishing that relationship and earning their trust. And that's something I don't take lightly, and I know that it's something that I want to work at and continue to improve my ability to show empathy, show compassion, and truly earn their trust as a physician, because I believe that that's the most important part in this physician-patient relationship.